Welcome to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo, and we have an interesting and detailed show for you tonight. We're talking about diabetes and wound care. We'll be joined by a panel of professionals in this field, hearing stories of patient success and taking questions from our viewers. Stay tuned. This is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at diabetes and wound care with St. Luke's University Health Network. Stay tuned. Thanks for being here. Let's get started. We have an amazing panel of guests joining us. Meet Stephen Bowers, a board-certified family physician and network medical director of wound care and hyperbaric medicine at St. Luke's. Dr. Bowers is a fellow of the American Professional Wound Care Association and an active member of both the American College of Hyperbaric Medicine and Undersea and Hyperbaric Medical Society. With an interest in research for the network, Dr. Bowers is currently involved in wound care clinical trials and is actively pursuing funding for hyperbaric research.
What I like most about helping my patients is the satisfaction of seeing them healed. That's one of the things I like about wound care and hyperbaric is there's kind of a starting point and an end point, and the majority of patients will heal them. So it's great to see a person who's been struggling with something and get them healed and let them move on with their life. I started part-time covering the wound centers. I'm a family physician, so I was doing this on the side. I enjoyed the patients, I enjoyed what I was doing, and it turned into a full-time role, which I love to do. Patients get treated in a hyperbaric chamber. In that chamber, they breathe 100% oxygen, and we increase the pressure, which allows us to push that oxygen into the liquid part of their blood and bypass the red blood cells, which is normally where oxygen goes. We can treat certain types of diabetic foot ulcers. We can treat patients who have had skin grafts from a plastic surgeon or a general surgeon, and they're having issues with that healing, or they need prep for a future surgery. I think St. Luke's as a network provides everything you need. It has all the specialists. It's continuing to grow and expand. I think it's a fantastic network.
Dr. Bowers, thank you so much for being here.
Thank you for having me.
For our viewers who may not know, what is wound care and how does it help patients?
So at the Wound Care Center, we basically just treat wounds all day long. So that's what the main focus is there. We have nurses who are trained specifically in wound care. We have providers who just do wound care. And then we have specialists that kind of surround all of us, plastic surgeons, vascular surgeons, podiatric surgeons, so we can all focus and manage the wounds together.
We're looking forward to learning a little bit more about the types of wounds that you treat and the various ways that they get treated. So thank you for being here.
Thanks for having me.
Joining our panel next is Ashish Shah. Dr. Shah joined the St. Luke's Center for Diabetes and Endocrinology in July of 2019 after completing an endocrinology fellowship at Cooper University Hospital in Camden, New Jersey. He received his medical degree from George Washington University School of Medicine and Health Sciences in Washington, D.C., and completed his internal medicine residency at Thomas Jefferson University Hospital in Philadelphia. He received his bachelor's degree in biology at St. Bonaventure University in Olean, New York, where he graduated summa cum laude.
I was first introduced to endocrinology during my residency. I thought the physiology of endocrine disorders is very interesting. I think a lot of the disorders are very treatable. The outcomes are generally very good. And I like the longitudinal care with patients as well. And I did really like diabetes care as well. My philosophy in care is to treat every patient as if they were a family member, explain to the patients about their endocrine disorders in terms they could understand. Then I try to go through all the evidence-based therapy options for the patient based on the latest literature and guidelines, and then come up with a collaborative approach with the patient that'll work best for their lifestyle and future needs. The staff here at St. Luke's are very excellent to work with. Everybody's very friendly, and we all have a single collaborative mission for improving patient care in the community, and I highly recommend care at St. Luke's.
Dr. Shaw, thank you so much for being here.
Yeah, thanks for inviting me.
Can you explain to us a little bit about the difference between type 1 and type 2 diabetes?
Sure. So type 1 diabetes is usually seen in younger folks, children and teenagers, and it's when your body's organ called the pancreas doesn't produce any insulin, and it's an autoimmune condition where your own body attacks the pancreas and you lose function of the pancreas and you lose your insulin production. So these patients are generally insulin dependent as the years go on. And type 2 diabetes is when your pancreas is producing enough insulin, but it's not working effectively in the tissues to absorb the sugar from the blood, and so you have a high blood sugar then.
Thank you, Dr. Shaw. Let's meet our final panelist, Eric Bronfenbrenner, who is board certified in foot and ankle surgery as well as podiatric medicine at St. Luke's University Health Network. He specializes in orthopedic care of the foot and ankle, limb salvage, reconstructive surgery, and orthotics. Raised in Allentown, he graduated from the Temple University School of Podiatric Medicine and completed his residency in podiatric foot and ankle surgery at St. Luke's Allentown campus. Dr. Bronfenbrenner is also a member of the American College of Foot and Ankle Surgery and the American Board of Podiatric Medicine.
Each foot has 28 bones in it. It's almost 25% of the entire bones in your body that we get to fix. And every single person at some point has a foot that hurts, and I get to let them go back to work with a foot that doesn't hurt anymore, and it actually is pretty fun to be able to do that. So podiatry is a pretty wide field. In general, it's pretty much anything in the foot and ankle pathology related. Our practice specifically, we treat everything from traumatic fractures to ingrown toenails to anything in between. There's really no typical patient. It sort of depends on the pathology. In the wintertime, we see a lot of people that fall. In the summertime, we see a lot of people that have active injuries like strains, sprains, cuts, lacerations. We take a lot of seashells out of heels in the summertime from the beach. And we see construction workers, we see Amazon workers, and we see a lot of people with either diabetes, heart disease, kidney disease who just can't heal as well and deal with a lot of complications of feet in that direction. Helping patients makes me feel great. There's nothing better than watching somebody stand up on their feet without pain, and you can see the look in their face when they realize it just doesn't hurt, regardless of the reason why. And it just feels really good to be a part of that. They're incredibly grateful when they walk out of that office without pain in their foot. Every patient is what you strive for to get that response from.
Thanks for being here, Dr. Bronfenbrenner. Thank you so much. Wondering what role does podiatry play in wound care? Because we're hearing a little bit, this affects a lot of different fields.
Podiatry wound care is almost single-handedly tied to diabetes. It's a epidemic across the nation, and a lot of diabetics lose sensation in feet and develop chronic wounds. Where podiatry comes into that is we can handle the surgical interventions if necessary, as well as the local wound care interventions to hopefully keep them out of the OR, keep them out of losing pieces of themselves. Try to come from a multi-focused approach just to get these better so they can go back to work.
Thank you so much. It's interesting to see that we're talking about really three distinct fields, and yet the crossover is so great. So we're going to be learning more from you in our next segment. Thank you all so much for being here. You've given us a better basic understanding of each of your disciplines, but coming up, we're going to make the connection between these three areas: wound care, diabetes, and podiatry. Stay tuned. We'll be back after a short break. You're watching St. Luke's Health Now.
Over 5 years ago now, I stepped on a nail outside our house with bare feet. Almost immediately after I stepped on the nail, it became swollen, and they believed that it pierced the tendon sheath. Wound up with a tetanus shot and Levaquin as my antibiotics. Maybe a year or so, year and a half later, I wound up with a callus that indicated it was bleeding underneath. Went to a podiatrist and he trimmed it out, and it turned out that there was some blood under there and a wound underneath the callus. Went ahead and had it removed, and it was basically a reactive lesion, they called it, possibly due to trauma, and it was attached to the tendon sheath of the left ball of my foot. It was just like a pinhole that was just constantly leaking that wouldn't heal. Eventually someone recommended a total contact cast. Dr. Brent Bernstein gave me a very large boot, and that was on a Friday. The next Friday I come back, he went ahead and cut the cast off, and my foot had healed. So after 3.5 years, that was a good sign. I think Myself, and along with all the other people that question where my crutches are, want to know how it happened in 1 week. I started my mountain biking again, doing some walking with the dogs, and it's still healed. Because of that, I ended my 3.5-year saga of a non-healing foot. I have no idea where I would be without St. Luke's.
Welcome back. Thanks for joining us tonight. I'm Ashley Russo, and this is Health Now. We want to thank our audience for being here with us tonight and providing us with questions. We'll get to those later in the show. Joining me is an important panel of medical professionals, Dr. Stephen Bowers, Dr. Ashish Shah, and Dr. Eric Bronfenbrenner. We've been discussing the basics of wound care, podiatry, and diabetes, sort of how they work together, and getting a better understanding now of these service lines and the care that you're able to give. So Dr. Bowers, I want to start with you. What are the dangers of wounds that don't heal for people with diabetes?
So patients who have diabetes are just initially at higher risk to have wounds or ulcers that won't heal. They're higher risk for infection. They're going to have delayed healing, and that's just from their underlying issue with diabetes. Ultimately, it can lead to pain, loss of work, localized infection, all the way to amputation. And if it's let go, ultimately you could lose your life if you just let something go and let the infection go. So
really not something you want to ignore, this wound management. It's important to get in, see your provider, and follow the instructions.
absolutely.
Okay. So Dr. Shah, there's something called diabetic neuropathy. And how does that play? What is it, and how does that play a role in wound development?
So diabetic neuropathy develops over a prolonged period of time when patients have hyperglycemia or high sugars for a long period of time, and that sort of damages the nerves to the feet, and essentially they develop lack of sensation, numbness, tingling, and because of that, they are more predisposed to having skin breakdown, and they can't feel if they have an injury to their feet, and that results in essentially in their ulcer development.
Dr. Bronfenbrenner, why are feet more likely to sort of obtain wounds in diabetic patients than other extremities or parts of their body?
I mean, the quick answer is we walk on our feet. These are people that work every day just trying to get a paycheck, and you've kind of got this perfect storm of the biggest area of your body that gets trauma, that you don't have any sensation to, that the tissue isn't as healthy, and something little very quickly becomes something very big. And unfortunately, because the lack of feedback, the patients oftentimes can't see the bottom of their feet, either from size or flexibility. They can't feel any pain. Sometimes I tell them just wear white socks. Look and see if there's blood on them when you take it off. Your first phone call's to me, your next phone call's to your boss to tell them you're not coming to work. We got to get these off the feet, get them clean, because if we can catch them early, we can often do a short-term treatment. If we catch them too late, it often involves surgery and much more significant issues.
As with most health issues, catching them early is often the key. Dr. Bowers, what is considered a slow healing wound? And how do you know if you have that problem? I mean, Dr. Bronfenbrenner was talking about often not even knowing you have the wound. What's considered slow healing?
So most people will heal an acute wound, depending on the size, 2 to 3 weeks if they go through the normal orderly sequence that our body goes through. Usually with the diabetic foot ulcer or other chronic ulcers that we see, you could put a time frame on it, and maybe it's greater than 4 weeks or 6 weeks. Really, it's if you're not seeing any progress towards healing. So if 2 weeks go by, 3 weeks go by, and it's, the wound is no smaller, the depth isn't less, anything, you should be progressing towards healing. So if you're not seeing any signs, you should get seen and have that managed.
And then really watch it to see what the progress is. If not, you need to get back in.
Absolutely, yes.
Dr. Shah, how often are you seeing patients with slow healing wounds, and how serious of a problem is this if left untreated?
So we commonly see patients who have diabetes with ulcers or wounds of the feet, and both in the clinic and at the hospital. And commonly our podiatry colleagues and our wound care colleagues and our primary care physicians are involved in their care as well. And it's a multidisciplinary approach to healing the wound and taking care of the diabetes and essentially improving their health.
Dr. Bowers, how important is education in all of this? Education before you get a wound and education throughout how to maintain the care throughout that process?
Mm-hmm. I think education is really the key to all of this. If a patient can be educated to keep their blood sugar under control, follow with an endocrinologist, follow with a podiatrist for routine foot care, and then know what to look for. They should be examining their feet every day and looking for any signs of a wound or a non-healing ulcer on their foot. And then if they do develop that, to get seen as fast as possible.
Education, always so important. Thank you all for giving us a little bit of a better understanding about wound care and wound management. But coming up next, we will learn more about how diabetic patients can be treated at the St. Luke's Center for Wound Management and Hyperbaric Medicine. You're watching St. Luke's Health Now.
My father is a diabetic, and we have diabetes that runs in our family. So I have a particular desire to help people so that they don't get the complications that I've seen in my family. As a diabetes educator, we see people one-on-one. We see people that are type 1 diabetics. We see type 2 people that are newly diagnosed. And what we actually do is we teach them how to look at their blood sugars so that we can find out where their blood sugar is high, and then we solve that problem. When people first come into the office, many people are anxious, depressed, because their diabetes is out of control and they don't know what to do. And we are here to help them. Number one, educate them on what they can do. And number two, give them hope that there is something, that there is a way to lower your blood sugar. I think St. Luke's has the perfect setup to have the most awesome diabetes education program because we have all of those resources for our patients.
Welcome back to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on innovative medicine. I'm your host, Ashley Russo, and we've had a really interesting show tonight. We've been talking about diabetes and wound care and how you can prevent it. In case you're just tuning in, I'm joined by three St. Luke's medical professionals, Dr. Stephen Bowers, Dr. Ashish Shah, and Dr. Eric Bronfenbrenner. Thank you all for being here. So in the first couple parts of the program, we established a little bit about your specialties, how you work together, and now we want to know a little bit more about the care. So Dr. Bronfenbrenner, I'm going to start with you. How often do you come across wounds that are unknown to the patient, and can you explain a little more detail why a diabetic patient doesn't feel the same pain level as a non-diabetic? I know you mentioned it earlier in the program, but explain to us the science behind it.
So first question, almost weekly I'll have a patient come in for an at-risk foot exam, and I'll say, what is this on your foot? And they'll have no idea. It could have been something that happened that day, a couple days ago, we don't know. But one of the main reasons I say this is why I see you routinely is they often don't know. And the reason they don't know is they don't have pain, it doesn't hurt. Maybe it's not really draining very much. Often a callus that you have on the bottom of your foot can break down into a wound, and it's not necessarily bleeding, but there's a small ulcer or a hole in the bottom of their foot. It's easy for us to see sitting down at their feet, looking up at them and catching it early. And at that phase, we often don't even need a wound care center. We can just do some very local things and hopefully keep them out of it. If we can't, that's where we can get them into the wound center to do grafting, surgical debridements. There's all sorts of options we can do in the wound center for the wounds that don't heal as they normally should.
So there is help. If people come in, they're maybe scared to see their doctor. You know, Dr. Shaw, you're seeing them often for a routine checkup related to their diabetes. How often are you finding a wound they're not aware of? And are you able to give them some treatments or recommendations that maybe are a little less scary than something that's more down the line of like surgery?
So when I see a patient with like a superficial wound or breakdown of the skin, I immediately refer them to our podiatry colleagues because getting both of us involved will help reiterate to the patient how important foot care is and to prevent the further development of the wound or ulcer. And I always recommend them that they check their feet every morning or have their loved one check their feet every morning and do proper foot care.
Just that basic maintenance and being aware of your
Exactly.
body and changes is really important. Dr. Bowers, you specialize in hyperbaric medicine. Tell us a little bit more about what that is and how does it help wounds heal?
Yeah, so hyperbaric medicine is a treatment where they put in a chamber, they breathe 100% oxygen, and we increase the pressure in that chamber. That allows the oxygen to get pushed into the liquid part of our blood, bypasses our red blood cells, which is where we normally have our oxygen. And then it can deliver a lot more oxygen to areas that need it. Areas that need it are usually non-healing ulcers or some other types of things that we treat also.
And how does it help with the healing process? I mean, how much more quickly can a wound heal using the hyperbaric method and chamber than more traditional?
Yeah, so they have to fail traditional wound care that we would do at our wound care center. So they have to kind of go through to make sure there's no infection, make sure they have good blood flow, make sure that wound's been debrided, and at that point they haven't made any progress.
Dr. Bronfenbrenner, how does the communication between your specialties and other specialists in the network work to help patients heal? How is that individualized approach?
It's huge, especially if a patient's admitted in the hospital. I mean, everybody's kind of right there, but even outpatient-wise, we have ways to contact their endocrinologist, their family medicine, their basically anybody we want to get to a team approach with it, and it's incredibly important because there's no such thing as just healing a diabetic foot wound. It's kind of a symptom of a much bigger problem. My role is kind of get the pressure off that area, get it clean through surgical debridements or wound care products, things like that. His role is to get the blood sugar, help them controlled so the patient understands that you can't heal when your blood sugar is wildly out of control. The family medical doc can help control the swelling in their limbs with diuretics and their heart issues and their kidney issues that also add to it. It's so important to have a multidisciplinary approach to these. And the nice thing within the network is that it's very easy for the physicians to safely talk to each other and get patient notes and interaction between all of them.
Often getting a diagnosis like diabetes can be very scary for a patient, and of course you can see why, because there are lots of things that can happen. Dr. Shaw, what's your approach to patients, and how do you make sure that they understand what they're kind of fighting against, and how do you work with them to improve their health and stay healthy along the way?
So first I tell them that diabetes is pretty common in America itself. 1 in 3 individuals have prediabetes, 1 in 10 have diabetes, and then I sort of go through the process of how the diabetes developed within themselves, and then I sort of talk to them about treatment options, whether that be diet and exercise or medical therapy. And there's several options for type 2 diabetes, about 7 different classes of medications. For type 1 diabetes, it's mostly insulin, but I try to reassure the patient that this is a very treatable disorder. We could work together to get the blood sugars controlled and improve your health for many future years to come.
Getting back to that education piece and also that team approach. All right, well, this has been a great conversation, and up next we're going to take questions from our studio audience. Thanks for watching. This is St. Luke's Health Now. Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. Thank you to our amazing panelists. This has been a very interesting and in-depth conversation. We've been talking about diabetes and the Wound Care Center at St. Luke's University Health Network. Now we have some questions from our studio audience. Are you guys ready? All right. Up first, I think that this is for you, Dr. Bronfenbrenner. I'm a diabetic, and I'd like to know what is the proper footwear, and also if I find a wound on my foot and my appointment is in 3 days, what should I do? Patients
all the time will call and say, I think I have a wound, and it takes 2-3 days to get in, and they ask, what should I do about it? Well, step one is make sure you're wearing your good diabetic shoes. Get off the foot as much as you can. If you have a bruise on your arm and you poke it all day, that bruise isn't going to go away. And I try to get patients to think about the wound on the bottom of their foot that way. Try to get pressure off of it. Keep weight on your heel if it's in the front of your foot. If you've got a pair of crutches, use them. If you've got a walker, use it. If you have a boot, use it. Do something to get pressure off. Keep the wound clean. Keep a big, dry gauze dressing over it.
So do not go about business as usual because you've got to get pressure off that foot.
Yeah, the sooner you get it off, the easier you will have time healing it.
All right, Dr. Shaw, I think that this question is for you. Does my blood sugar affect my body when a wound is trying to heal?
Yes, so if you have uncontrolled high blood sugars above 180, that generally impairs the immune system to heal any wound or ulcers that are on the feet. It also contributes to plaque buildup in the arteries that lead down to the feet, which impairs blood flow, and then that'll impair healing as well. So tight blood sugar control is important for healing in general.
Not just for prevention, it's important throughout.
Yes.
Okay. All right, Dr. Bowers, this is for you. What are the benefits of going to a wound center, and do I need a doctor's referral to go there?
Kind of like I said earlier, I mean, the benefit is you're going to get providers and physicians and nurses who only deal with wounds. So you're going to get the expertise that they can deliver. You're also going to get, you know, at most primary care offices, they're not going to have the appropriate dressings, the appropriate staff. It it takes time for us to manage these wounds. So we see them back frequently, usually on a weekly basis, and you know, we are set up to be able to handle both the frequent visits and the dressings that are needed.
All right, so Dr. Bronfenbrenner, I think this is free, but anybody can jump in. How do I know where to go if I think I have a wound that isn't healing correctly?
St. Luke's has wound centers throughout the Lehigh Valley as well as in Warren, New Jersey. If you have a podiatrist, you can start with them. You can get in there. We often have people show up at our office first, and then we make an appointment for them at the wound center because they don't know the wound center exists. Oftentimes, family doctors that notice it make the appointment for them. What I usually say to people is tell somebody. Don't just assume that it'll take care of itself. Any of the docs can help you. Diabetic foot wounds are known throughout any specialty as being incredibly dangerous if left untreated. And any physician that you tell, I think I've got a wound, will help you get to where you need to be.
All right, I think we have time for one more question. So Dr. Bowers, this is for you. I don't know if you know the answer to this, but what is it like being in a hyperbaric chamber? I'm very curious about that myself.
Unfortunately, well, I guess fortunately, I don't know the answer to that. I've never been in the hyperbaric chamber, but I mean, we treat patients every day in the hyperbaric chamber, and it's actually very well tolerated. Everyone is initially concerned because, you know, if anyone looks it up, you see that clear acrylic tube that you kind of slide into when the door shuts. But when you're inside there, again, it's clear. There's a TV, there's speakers, there's a phone that you can communicate with the hyperbaric technician who's there, and that hyperbaric technician is at their side the whole time. So, you know, really the biggest issue with hyperbaric is it's a pressure treatment. So they have to clear their ears just like if you're flying on a plane or if you're a diver and you know what that's like to clear your ears. Beyond that, it's a 2-hour nap for most patients.
I would say we've filmed with several patients and they seem pretty relaxed through the whole process.
Yes, yeah.
Well, thank you all for giving us a little bit of a better understanding on wound care and management, managing diabetes and foot care at St. Luke's. Obviously, like anything else, early intervention and education is key, so we appreciate all of your efforts. Thank you for being here. For more information about diabetes and the Wound Care Center at St. Luke's University Health Network, please visit their website at sluhn.org or call InfoLink at 1-866-ST. Luke's. I'm Ashley Russo. This is St. Luke's Health Now. Thanks for tuning in. Until next time, be well, and remember it's important to focus on your health now.